Good morning, welcome. Today I have the pleasure of speaking with Dr. James Hopkisson, who is Medical Director at TFP Fertility UK. Welcome.
Hello, thank you for having me to come and talk about endometriosis.
It is Endometriosis Awareness Month this month, March, and the first question I would like to ask you is, can you have a successful pregnancy with endometriosis?
Yes, most certainly. And you have to look at what is endometriosis, how we grade it, and the effects on people's fertility. So, want to really dismiss this myth that you can't get pregnant with endometriosis. Endometriosis is a spectrum of disease and is graded mild, moderate, or severe. And there is an American Society grading system as well of 1, 2, 3, and 4. So it will have an effect on fertility, but it doesn't mean that you can't carry a pregnancy or conceive spontaneously or with assisted conception.
Do most people with endometriosis require treatment to help them get pregnant, or can they do so without assisted reproduction naturally?
Again, it depends on the stage of disease and what has happened within the pelvis. If you have tubal blockage because you've got severe disease, adhesions, then IVF will be required. But superficial endometriosis, you can conceive spontaneously. If you are getting additional symptoms like pelvic pain, pain with your periods, that might be diagnosed at laparoscopy and treated. And there are studies out there that suggest that treating superficial disease does increase your chances of falling pregnant naturally.
How does age play into it? For example, if you have a diagnosis in your late 20s, when would be the best time to start trying to conceive?
I think for anybody thinking about conceiving, it is a very personal decision. We know that success rates of fertility treatments are higher when you are younger, but it has to be the right time. So if a diagnosis of endometriosis is made in the late 20s, one has to be fertility aware, but you have to be with the right person, ready to start a family. So it's keeping those figures about declining fertility with age in mind. Certainly, I don't say to a patient diagnosed with endometriosis, you must go and get pregnant now. But I would say, okay, you've got to look at where you are, what you want, what your fertility aspirations are, and bear your endometriosis diagnosis in mind. But certainly, I wouldn't say to somebody, go and get pregnant as a cure or a treatment for your endometriosis. I think that's very old fashioned and doesn't take into account the wider life, really.
When people are starting to try and conceive with endometriosis and they perhaps come to you at TFP Fertility UK, where do you suggest they start?
I think we have to look at what are your baseline ovarian reserve tests like? What are your symptoms like? Some people may want to look at their quality of life before embarking on fertility treatment, or crack on with a fertility treatment such as ovulation induction or IVF. It all depends on the individual. We have to tailor treatment to the individual, the extent of the disease, the symptoms that are being experienced, and the desire to fall pregnant. So I would say people with endometriosis should be managed in a very similar way to all fertility patients. Be given information to make informed decisions, and then a personalized treatment plan that will give them an idea of relative success rates, the costs, physically, emotionally, financially, if they're not eligible for NHS-funded treatment, and then signpost them to gynecologists who have an interest in both fertility and endometriosis. Because if treatment of your endometriosis is required, one needs to have a surgeon, a gynecologist who is sympathetic and knowing about your fertility wants, needs, aspirations. So unfortunately, the vast majority, all of the medical managements of endometriosis are contraceptive. And you have to then work out how much of quality of life can be sacrificed almost for fertility treatment. And there are some medical managements that we can run fertility treatment straight off the back and move into fertility treatment, hopefully without having a return of symptoms if they've been well controlled with medical management.
Should people prepare for surgery, laparoscopy, for example?
But it depends where you are in the fertility pathway. Some people will arrive at their initial fertility consultation, potentially after 6 months or 12 months of trying, with symptoms of endometriosis. It would be entirely reasonable then at that stage to perform a laparoscopy, and that laparoscopy should be there to diagnose endo, to diagnose tubal patency, but most important, if superficial endometriosis is found, to treat that disease. If more extensive disease is found, stage 3 or 4 with potentially bowel involvement, and there are symptoms that may signpost that diagnosis, then a 2-stage procedure may be required, and one again has to balance out fertility aspiration and quality of life. So when you are talking about more extensive surgery for endometriosis, it is not without risk and should be done by somebody who has the skill set to manage endometriosis laparoscopically without resorting to open operation, operating to preserve ovarian reserve. How one does that if there are endometriotic cysts is still highly debated. There are different types of surgery that one can employ. So I think when you are looking at your fertility, look for a specialist who will guide you with taking your endometriosis into account. And if they are not the surgeon for you, if you need surgery, that they have a network to refer into. And an endometriosis center is, a very, very important. And seeing those surgeons who are dealing with endometriosis, severe disease, day in, day out, with a multidisciplinary team is very important. But preparing for a laparoscopy, you need to be as fit and healthy as possible. Make sure your BMI is as low as possible. It makes surgery, anesthesia, recovery that much easier. So the preparation is all very straightforward. Wellness, really.
Diet and nutrition, you just mentioned well-being. Do these impact endometriosis?
I think hugely. There is such a crossover with endometriosis, bowel symptoms, and I've had many patients who have altered their endometriosis symptoms by altering their diet. Looking at your diet, things that may aggravate. Unfortunately, still, we see many patients with endometriosis diagnosed or some may say fobbed off at times with a diagnosis of irritable bowel syndrome. There is crossover, of course, but looking at what triggers there may be in your diet may help with your endometriosis. There are, if you go to the endometriosis organizations, there are endometriosis diets. And, you can still have endometriosis with IBS, with celiac disease. There are a huge crossover. So I would always tell my patients to see if there are any triggers, any foodstuffs that may be worse. I think it is very individual. When you're looking at the IBS diet, the FODMAP diet, it does cut out a lot of food groups. And if you find something that triggers your discomfort, pain, that it is a case sometimes of trial and error. So would I say that there's anything that you should be taking or eating? No, I think, again, it is very much being as healthy as possible, being sensible, but don't ignore your diet. I know there is massive growth in looking at the gut microbiome, different supplements that may help with your general health. The inflammatory process of endometriosis may be controlled by some aspects of your diet. So we're not all cynical doctors who just say this is a disease where the lining of the womb is outside, cut it out, or squash it with drugs. It's a holistic approach. One always talks about marginal gains in sport. If you find something in your diet that decreases your pain by 5%, do it. It doesn't matter if it's not happening to 100 other people. If it's happening and working for you, that's great.
Is there any positive action that people who are struggling with endometriosis can take from home? Anything else they can be doing with their lifestyle further to what you've just mentioned that you would advise at TFP Fertility UK?
I would say if you are struggling and not getting the answers, ask a specialist. We know that the delay from first symptom to diagnosis of endometriosis in studies has been shown to be almost 8 years, which is still in this day and age unacceptable. And, young women in their late teens with heavy, painful periods, need to be aware that this condition is something that may be affecting them. If their mothers had endometriosis, sisters, there are strong genetic links in families. So, not being fobbed off is very, very important. And if you're not getting the answers, there are lots of endometriosis and fertility specialists out there with an interest in endometriosis. It still surprises me in my old NHS practice, in the fertility unit now, how many people have taken so long to get a diagnosis. And, just having a chat about looking at them holistically, there's suddenly a light bulb moment. Why hasn't somebody said this to me before? As a gynecologist, it is one of our commonest conditions that we find. In fertility, studies show, if you laparoscope fertility patients, you may see 40 to 60% of people have endometriosis. Admittedly, if you have an interest in it, you will look for it more. But nevertheless, it's there. There are things that we can do to help with your quality of life and for your fertility if needed. And I suppose the difficulty is once it's diagnosed, what impact will surgical management have on outcomes of IVF, of fertility treatments? And that's where you've got to get a sensible opinion and look at what you're willing to put yourselves through in terms of treatment.
Following an early pregnancy test at TFP Fertility UK, those patients who are struggling with endometriosis, are there extra checks, scans, tests that they have?
I think for anybody concerned about their pregnancy, we can scan more frequently. We can look at HCG levels, although it's not going to really alter our management. It's there for reassurance. Sometimes with HCG measurements, we may cause more worry. Is the level rising quickly enough? Do we need to give more progesterone? The vast majority of IVF programs will be giving adequate luteal progesterone support following IVF. And we don't know what is too little, what is too much. So again, a lot of assisted reproduction, ART, is a bit of an art because, we don't have the evidence base in some aspects and are trying things to improve outcomes. I think any add-on to assisted conception, you have to be aware of the evidence base, the risks, the costs up front, and that is very, very important. But actually saying, here is a tablet, here is a treatment that will improve outcome for endo patients is not possible. if somebody wants to do acupuncture, reflexology, because it is good for them mental health wise, alleviate symptoms, that's fine. Supplement wise, I would recommend that all people are taking folic acid and vitamin D, antioxidants, carry on with that regime that is working for you.
Will patients still experience pain from endometriosis during pregnancy?
One of the benefits and why some gynecologists say go and get pregnant is endometriosis is suppressed during pregnancy. The pregnancy hormones will dampen down your endo. Will that return as bad after delivery? Only time will tell. Some people do report that their endo symptoms are much improved afterwards. Will it alter delivery? That's something we get asked quite frequently. Should I have a cesarean section? Will my endo cause a problem in labor? It shouldn't do. And one should approach labor and delivery as normal, really. Yes, all assisted conception pregnancies are precious. Every pregnancy is precious, whether you have endometriosis or not. So be advised by your obstetrician and make a plan for delivery and pregnancy that manages any symptoms that you may have. If you have cysts and things like that, how do we keep an eye on them? Are they causing problems? Usually endometriosis settles during pregnancy, but it doesn't go away.
So it does not cure endometriosis. Pregnancy does not cure endometriosis.
Well, endometriosis is the presence of endometrial tissue, the tissue from the lining of the womb, which is made up of glands and stroma at distant sites. So it can be in the pelvis, be up on the diaphragm. There have been reports of people with endometriosis in the lung. So, it gets there either by going through the tubes and implanting. There are ways that can be that tissue can move through the bloodstream, and lymphatics have been proposed. So the cells implant and cause lesions, inflammation, scarring. So you've got the effects of the tissue, but also the inflammatory scarring effects as well. So if, say, with stage 3 and 4 disease, where you've got significant scarring and adhesions, that won't go because of pregnancy. They're there. So it will dampen down the endometrial tissue that is causing the problem.
Why do you think there's a gap in research between infertility and endometriosis?
Because it's a very, very big area. Unfortunately, the funding for research into endometriosis is not driven as well as for heart disease, cancers, and unfortunately, there is this lack of pressure pushing along women's health issues, and hopefully the government's 5-year plan for improving women's health will increase research into it. I started doing research into endometriosis in the early 90s in Oxford with a team there who were looking at the genetics of endometriosis, how endometriosis implants, differences between, my research was looking at the differences between the tissue of endometriosis and the lining of the womb. Were there differences? Were there targeted treatments that we could offer? Unfortunately, it has been a really slow process.
3 top tips for those trying to conceive with endometriosis from TFP Fertility UK.
Get the right advice. Be fit and healthy. And the 3rd tip, don't worry. There is something there that we can do for your quality of life, for your fertility. We just need to see you to help you.
Fantastic advice. Thank you so much, Dr. Hopkisson, for all of this fantastic information you've given us today. We really appreciate it. And no doubt many people will find it very, very useful.
Well, thank you very much for having me. I think it is very important that there are lots of online resources out there. The Endometriosis Society, get to them as well to look at their websites for information. I think that's key as well. Patient support groups as well, very, very important. I didn't really mention those. Meeting people who are going through the same sort of treatment pathway is important to get their advice as well.
Definitely. Thank you again.